We're going to spend a few minutes here talking about the autism spectrum disorders. So we'll just go ahead and get started with that. The etiology of the autism spectrum disorders is really unknown. There are a lot of theories going on, a lot of guessing, but they really don't know. There does seem to be a link between hereditary, genetics, and medical problems. Immune and environmental factors may contribute to the development of the disease. Specifically, they've mentioned viral infections if they interact with the genetic susceptibility. And if you remember, we talked about genomics at the beginning of semester and understanding the interplay between our genes and our susceptibility to different diseases. Twins, interestingly, monozygotic twins have a high rate of concordance. 60 to 90% of twins, if one has autism, the other will have it. It's pretty amazingly genetically linked there, it seems. The dizygotic twins, two separate eggs, they have less than a 5% concordance. So again, kind of demonstrating that the genetics may play a role with those monozygotics. There is also a high risk of recurrence in subsequent children. There is no link between autism and the measles, mumps, or rubella vaccine. I know there's lots of theories, a lot of people believe that, but the studies just do not support it at this point in time. And I'm going to flip back to that genetic susceptibility issue, that perhaps the MMR vaccine might have turned on one of those genetic susceptibility factors so that it reacted differently. There are also several prenatal factors that have shown to have some potential common denominators as risk factors, but we are not, right now it isn't definitive enough to say this or that does or does not cause it. Bottom line, we don't know. The clinical manifestations of autism has a very wide variance, okay? You'll have some children who are minimally effective, and then you'll have others that are on the severely affected end of the spectrum. I have seen both ends and in the middle of children with autism, not as their nurse, but just as a human being out in society, and working in a church where we had a severely autistic child that we took turns helping him adapt to the environment as his parents were, and his mother really was in church. So I'm sure in your own life you've come across autistic persons of different levels of impact on their ability to be social. Some have very bizarre lack of social skills. And the typical ones are no eye contact. They don't want to look at you. They turn away. They don't like to be touched. They avoid body contact. There's a language delay with most of these children. They have a limited ability to play. You put them in a sandbox with toys and they're not going to interact with the sand and the toys in the usual manner. So it's just they're just in their own world, kind of. Constipation is common. That's a medical problem that they tend to all have for some reason, or increase of constipation in this population, I should say. And as I mentioned, the severity of symptoms varies greatly. The majority have some level of cognitive impairment, about 50 to 70%. So that's a large percent will have an impairment in their ability to figure things out. On the other side hand, though, some autistic children excel in particular areas of ability. They may be awesome in arts, excuse me, math, music, memory, perceptual skills, puzzle building. You see the kid doing the Rubik's Cube in 15 seconds. That is amazing abilities that a certain area of the brain is hyper developed. Of course, you may have heard they're called savants. I don't think they use the word idiot savants anymore. I certainly hope they don't. So just savants. Speech and language delays are common in the autistic children. As a guideline, just to keep in mind, infants should be babbling and gesturing by about 12 months, showing evidence that they're aware of the world outside themselves. They should be speaking single words by 16 months. Mama, dada, kiki, kitty cat, doggy, gog, whatever. They should be speaking. That's our way of trying to interact with people other than ourselves. And if they're not doing that, they are showing no interest in doing that. They should be speaking 2-word phrases by 24 months. So language should progress at a fairly predictable rate. There are variances in that in normal babies too, so nobody freak out if your baby's not speaking in 2-word phrases by 24 months. But just be aware that that should be a progressive ability in a child. If they had reached a certain ability and then they declined, that's a red flag. That needs definite follow-up. Additionally, things they might have is abnormal EEGs. They may have epileptic seizures, a delayed development of hand dominance, persistence of primitive reflexes. You can see those are all, brain affected. So it seems to center somewhere in the brain development. Metabolic abnormalities. They may have an elevated blood serotonin level. The cerebellar vermal hypoplasia may happen, and all you need to really know about that is that's the area of it happens in the area of the brain that affects motion and memory. The infantile abnormal head enlargement can also happen. So a lot of head stuff going on with this. Neurological. The prognosis for autism, it's usually a disabling condition. Some may ultimately achieve independence, but most do require lifelong adult supervision. They just don't have the intelligence, the ability to adapt to changing environments. They lack the ability to get help should they need help because they don't want to reach outside themselves. So it's a very high-risk situation. Psychiatric symptoms may become aggravated in this group of persons, especially in girls. Early recognition is critical. If appropriate interventions can be implemented early, they have a better chance of working through a lot of this and adapting. They'll never feel comfortable in our world, I don't believe, but they can learn how to function in our world without severe anxiety. Family involvement will also help, both the family and the patient. Therapeutic intervention is a specialized area involving professionals who have had advanced training. So this is not for the weak. It's not for the ones that haven't studied it. It's a very specialized area of work, and those people need to be brought in as soon as possible to help with treating the patient with autism. The most effective therapy to date is a highly structured and intensive behavior modification program. Highly structured. Autistic children cannot adapt well to change. That's one thing you're going to need to remember when you take care of these patients. They do not do well just with change, and here they are, their whole environment has changed because they're in a hospital doing things that they don't usually have to do. So really keep that in mind when you're taking care of the person that has autism. And we'll talk about that in the next slide. But that's where that highly structured, when they're in the hospital, do as much structure of their environment as you can. Keep it consistent as much as possible. The goal is to promote positive reinforcement, increase social awareness of others, teach verbal communication skills, and decrease unacceptable behavior. Some autistic children will learn that this would be when you smile. So they smile because that's what they've learned. This is the time when you would smile. I swear every time I do a video, my clock goes off. They learn when there's a joke that they should laugh. They don't really feel the need to laugh, but they laugh because they've learned that that is the appropriate response. So their reactions may be forced and not natural, but it does show their desire to integrate better in society. Those are the successful ones, successful cases. This is the slide with the that will involve how we can best care for the hospital child with autism. Parents are essential and encouraged to stay with the child. Nurses, that will help keep that environment a little more stable for them. The person that they know and love the most be there with them. Nurses must be aware of the need for personalized care plans. And you're like, well, we do that for everybody. Yes, we do, but each autistic child is even more personalized, because the level of autism is different. Their ability to cope is different. So really need to do a thorough assessment of using your observation skills of the patient, as well as listening and talking to the parents that are there with them, and the patient, of course, him or herself, but be very personalized with that. Keep the room in a less stimulation. The minimize auditory and visual stimulus, because that will help decrease that tension that they feel, that anxiety. A private room is almost required, I would say. Encourage the parents to bring favorite home items. When I say that, I hesitated to use the word home toys or bears, because the toy issue, but they may have something that they really cling to at home that brings them comfort. The blanket, the teddy bear, the whatever is that child clings to. Encourage the parents to bring that in if they haven't. When you're talking and assessing for this patient, assess for their reaction to touch and minimize it if it has a negative effect. Respect their need for boundary there. Be wary of feeding challenges. Some of them they are very picky, fussy eaters. They can really act out at this time of their daily schedule. It's one way they can really get back at you, just spit it out at you. So just be aware of that. Understand that they're not being disrespectful. They're just acting out in the way that feels most comfortable to them. Keep your time in the room with the child short at first. Don't overwhelm them with your presence for a long time. Introduce yourself. Give them a short description of what you're going to be doing for the next 5 minutes, and then let them adapt to that. Allow for a gradual acclimation to the environment, if at all possible. Emergencies, different story. Okay, we're talking about the child that doesn't have an emergency going on, and we have the blessing of time to work on our side with this child. Use a very direct communication style. Keep it brief and concrete. These children will, and again, they may not look at you, but just you watch their expression, you watch their face to see if what you're saying seems to be getting inside their head somehow. So just realize we've got to slow down, take it slower with these children, and be as straight with them as we possibly can. The family side of autism. Autism is a family disease. Some parents will feel guilt. They think, oh, I shouldn't have given them that MMR vaccine. Oh, I shouldn't have done this, or it was because I didn't breastfeed, or I don't know. We can pour guilt on ourselves as easy as we can get up out of bed some days. So our job is to help alleviate the guilt and shame by accepting that this child is a perfect child as he or she is, and acknowledge the biological basis of the disorder. Reassure the parents that they did not do anything wrong. This is this child's way of dealing with the world, and we're going to fit inside his world and help him as best we can then fit into our world. It's a two-way street. The Autism Society is a website that offers great resources, a lot of resources, information for family members. Support, of course. The online support group you get frustrated because they're very difficult to take care of sometimes, especially as they get bigger, stronger, and they don't want to do what you need them to do. It can be very, very challenging and exhausting. Encourage the family to care for the child in the home if at all possible and as long as possible. But as I said, some of these children, when they get big, they get beyond the ability of the family, and it really needs to be discussed, not in a way of guilt, but in a way of this, what's best for this child. And the family is part of this child's world. And in summary, I know you've all seen the puzzle, the awareness, the autism awareness ribbon, the puzzle pieces. And I just wanted to share this with you, that the puzzle pattern of this ribbon reflects the mystery and complexity of autism. The different colors and shapes represents the diversity of people and families living with this disorder. It affects every culture. Nobody is not at risk. The brightness of the ribbon signals hope, hope through research and increasing awareness in people like you. So that's it on autism.